Well, the federal government is spending more than $100 million over the next 5 years on public education and awareness, a lot of it about the risks associated with cannabis consumption. There are plenty of public health aspects to consider with the legalization of cannabis, especially with younger Canadians. To talk about that, I'm joined by two guests. Amy Porath is the Director of Research and Policy at the Canadian Centre on Substance Abuse and Addiction. She's with me here in the studio, as you can see. And from the University of Waterloo, David Hammond, a professor of public health who has also studied cannabis policy and usage. Welcome to you both. Good to have you both here to talk about this important subject. In terms of public health, Amy, let me start with you. What's the biggest unresolved issue as we enter this era of legalized cannabis?
Well, I think we have a huge opportunity ahead of us now that cannabis is legalized to really educate Canadians, particularly young Canadians, about what are the effects of cannabis, both some of the harms, but as well as some of the benefits. We know that cannabis is used for medical reasons, and we heard in a lot of our research with Canadian youth that there's a lot of misperceptions and a lot of confusion, just mixed messaging. So I think with legalization, we have a huge opportunity to raise the bar in terms of awareness of this issue.
Okay, David, let me ask you, Canada has one of the highest consumption rates for youth in the world, even though some statistics show that we may be in a bit of a downward trend these days. But do you think legalization will encourage more young people to consume cannabis? What do you think is going to happen as we enter this period of legalization?
Well, we can look at the experience down to some of the U.S. states that have legalized, and it suggests that there are no dramatic changes necessarily in terms of increases in youth use. There's a bit of mixed evidence, but it's pretty much followed trends prior to legalization. What really changes is what types of products people source and where they purchase them from. So, we are now in a situation where provincial retailers and private retailers, depending on where you live, will be the ones selling you the cannabis products. And so that means potentially greater product standards. It also means some interactions where we have the opportunity to have this conversation where information isn't just about should I use cannabis, but what's the difference between responsible and problematic use? What do I know about the many different products on offer? So a lot of things will change. Part of that is our opportunity to talk to Canadians and to young Canadians about the substance.
All right, I want to get into that a little more, but so let's go there now then. What are some of the big misconceptions that young people have about using cannabis?
Probably one of the biggest ones we've heard is they think that it's okay to drive after using cannabis. They think it's safer to drive after using cannabis compared to drinking and driving. We've also heard, we think it helps my school performance, cures cancer. We've heard a lot of misperceptions through our research with Canadian youth.
Right, and so how do you get at that? How do you get at that education process to maybe the wrong use to straighten them out about some of those misconceptions?
Well, it's about really presenting the evidence, presenting the facts in a balanced way to young Canadians. Through our research, we heard that the scare tactics approaches, they don't really work. Youth want to receive the evidence, receive the facts, and then make an informed decision. We know that a lot of Canadian youth are already using cannabis, and part of the education is presenting harm reduction strategies, so how they can protect themselves, reduce the risk if they do decide to use cannabis.
David, let's weave into that the conversation that if you go from province to province and look at the different, there's nowhere in the country can you buy legal marijuana if you're under the age of 18. Quebec might actually be as high as age 21, according to the new premier there. What about that whole cohort of young people who use cannabis below the age of 18? Are they just likely to stay with the black market, and doesn't that sort of work against the government's objective of trying to wipe it out?
Well, in theory, any time a youth would buy a product, it's an illicit product, whether that would come from a legal store or a dealer operating outside the regulated market. That's a problem today. It's been a problem for many decades, and it will, continue after legalization. And as Amy said, what's interesting about this substance is there are misperceptions on either extreme. There are people that have exaggerated beliefs about the therapeutic qualities of cannabis. There are some that lump it in the same category as opioids, for example. And one of the biggest challenges is finding a way to communicate to youth that, look, there are extra reasons why early initiation and regular use of cannabis among young people causes risks. It's one of the best predictors of future problematic use, which is starting it early and using it often. So some way, we have to find a way of regaining some credibility on this issue. And, as Amy said, communicating that you shouldn't be using this regularly if you're a young person. If you do use it regularly, here are some points to consider, which is don't drive, don't use it at school or work, know what types of products you're using, know the difference between an edible, where you might not feel the effects for a couple of hours, and other forms where you feel them immediately. So these are the sorts of messages that we need to communicate with youth, and maybe in some odd way, the community has more credibility under legalization to talk and have those conversations.
Amy, you want to jump in on that?
Yeah, and I'd like to just highlight to navigate those difficult conversations about how do you talk to young people about cannabis. So we've put out this talking pot guide. It's not going to tell you what you need to say to youth, but rather it's how to set up the conditions to have that conversation so that youth feel comfortable asking their questions. The youth ally, and by youth ally I mean it could be a parent, it could be a coach, it could be a teacher, healthcare provider. We've heard from them that they struggle with how to discuss this issue with youth, and really they want to have a supportive conversation. So this is a 3-piece guide that is meant to inform parents about how to have that conversation. If someone your child comes up and says, well, what is cannabis, and I heard this from so and so, it's really how to be non-judgmental, non-biased.
In fact, would you suggest that parents not wait for the question? Don't wait for your child to come up and say, hey, look, I've been approached about cannabis. David, I mean, is this an opportunity for parents? And there's a whole lot of parents in the country who don't support legalization, don't want this.
Yeah.
But is this an opportunity for those parents to push past that and sit down with their kids and say, look, we need to have this talk?
Look, absolutely, and it's the same as talking to kids about sexual health and alcohol. If you wait for your kids to break, that topic with you, you're going to be waiting an awful long time. Look, this substance wasn't invented through legalization. Any parent that thinks about talking with their kids about alcohol use, I would suggest that you have a similar conversation with cannabis, which is these are substances, they're legal. Many people can use them responsibly. Some people have problematic use, and to have conversations with them. So don't wait for your kids. In some ways, the fact that we've legalized cannabis, it gives the government a greater mandate and responsibility to have these conversations. It's probably the same for parents, when you're walking by a store and your kid says, what's that? But these are conversations that we should have been having for a long time. So if nothing else, it's an opportunity in that sense.
Amy, we talked about you were actually part of the government's awareness campaign group that helped put it together. I don't go back to some of the campaigns around cannabis. Go back to the 30s and reefer madness, and David talked earlier about the extremes on both sides of the conversation. What's different about the awareness campaign, the educational campaign being put forward by the government this time compared to others?
Yeah, I think it's a really good balanced approach where we took questions from the public and we just answered them. So they had a pool of experts based on the science. This is the best evidence we know, and we tried to answer their questions. And in some cases, we didn't have the evidence to answer the questions, and that's sort of where the state of the research is in cannabis. And as a scientist myself, I really see legalization as a huge opportunity to really advance that national research agenda. And I think Canada could really play a leadership role in that regard.
David, let me ask you about, we've talked a lot about young people, but older Canadians may want to, who may have never have used it in the past for all kinds of reasons, may decide now they want to get in on the action too with legalized cannabis. What do they need to consider?
You're absolutely right. When we talk about education, obviously we think about youth, but we need to think about adult consumers. And some of the data in the US suggests that some of those folks come out of the woodwork, and maybe they haven't done these products in a long time, and they think, I'll give it a try. As with youth, it's not just, is it good or bad for you? This isn't a moral argument. It's about learning a bit about the cannabis market. And the cannabis today is not the cannabis that your dad or grandpa may have tried. We have high potency concentrated products that most of which didn't exist even when I was a youth. We have oils, we now have vaporizers, we have all different forms of administration and dosage. And we need to teach Canadians a little bit about that. And we'll have some information on product labels. But trust me, any of your viewers that walk into a store, they're not just going to see the old dried herb that people remember, using behind the schoolyard. They're going to see a wide array of products, and they can have very different effects. And so we need to teach Canadians not just the basics of don't use this if you're susceptible to psychosis or driving or working, but the term that people use is start low and go slow, and that's especially true for these newer forms and varieties.
Amy?
Yeah, and I would just add that the federal government will be introducing legislation for edibles. So the drinks, the cookies, the brownies. So there's going to be a whole new range of products the fall of next year. So I think consumers really need to get educated about the different types of cannabis products, and with that education, they'll be able to use it responsibly.
Quick final questions to both of you, and Amy, let me start with you. So as we go down this road, what is it you'll be watching for? What are some of the key markers you want to see to be able to measure what's happening with legalized cannabis in this country? Because we've talked about it in our discussion today, is that it's not always been easy to get information. Now that it's legal, one presumes more people will volunteer that they're using it. There might be better empirical information that you can deal with in studies and so on. So what are you watching for?
Yeah, so I'll be looking at the prevalence data, both in terms of trends in youth use, seniors as well is a group that I'm particularly interested in, rates of cannabis impaired driving. I'll also be looking for sustained investment in public education efforts. I think it's great we have all of these campaigns that are running now, but I think we need to have sustained efforts. If we look at the successes, in the drinking and driving, we had 30, 40 years of sustained public education and awareness to really bring about that change. So I would say that's, we need to keep going with our public education and evaluate along the way to make sure that we're on the right track.
David, what about you? What are you watching for?
Two things. One, I'm interested in the industry's conduct. The whole idea of legalization is premised on the idea that these products are not promoted in any way to youth or in ways that are appealing to them. That's a very slippery slope, as we've seen with tobacco and other areas. So I'll be watching the industry's conduct and how they market their products very carefully. Number two, I'll be interested in differences across provinces. Depending on where you live, you may have very few stores, you may have multiple stores very close to each other. So very different approaches in different provinces in terms of the retail framework, and we should probably understand if there are implications for who's using and how much.
All right, thank you both. Lots to think about in that conversation. Appreciate you both joining me to have that talk. Amy Porath, David Hammond, good to talk to you.
Thank you.
Take care.
Thank you, my pleasure.